Hello and welcome to this week's Clarity Parents Chat. The topic we are going to discuss today is understanding triggers for kids with a mental illness. My name is Gerard Mijon and with the Clarity Child Guidance Center, and we look forward to an engaging conversation with our guest speaker, Andrea Tristan. This talk is a production of Clarity Child Guidance Center, which is, for those who don't know us, we're a nonprofit treatment center solely dedicated to helping children 3 to 17 with their mental health. Clarity is located in the San Antonio Medical Center and provides inpatient and outpatient services to several thousand of children every year. You can read more about the center at claritycgc.org and about the children's mental health on our prevention and education website, 25mic.org. Before we start, a few technical details. The webinar will end at 11:30, including a 10-minute Q&A at the end. This talk is recorded, but none of the names of the attendees will show in the recording to protect your privacy. That is also why we are not taking live questions. However, if you have questions for Andrea, we invite you to post them in the chat space at any time during the talk. Of course, this event is purely educational and is by no means an attempt to provide counseling online. Andrea Tristan is a licensed professional counselor and certified clinical trauma professional. Andrea has various counseling settings, including a youth homeless shelter, mental health residential treatment center, community agencies, and now in outpatient therapy. Andrea is passionate about helping children and families work through and overcome tough times with a nurturing and empathetic therapeutic approach. Andrea, welcome.
Hi, Gerard. Thank you. I'm glad to be here today.
Great to have you. So let me start directly with an important question is when we talk about triggers, can you give us some background? Especially, is there a difference between actual causes of mental illness and triggers?
Absolutely. So triggers, I think, are essentially anything that might, what I would say, activate us. So anything that might create an intense emotion, whether that be, most of the time it might be feelings of anger, it might be feelings of sadness, any kind of intense emotion in response to a comment, an event. Triggers can vary widely for everyone. So triggers are not necessarily indicative of a mental illness and don't necessarily cause mental illness. However, people with mental illness can definitely have specific triggers that are either more difficult to manage or triggers that exist because of their mental illness. For example, an adolescent diagnosed with depression might feel triggered when someone teases or criticizes them, and they might exaggerate this comment or feel intensely hurt and have difficulty managing those feelings because of their depression. And again, you can also have, on the opposite end, you can have certain triggers without having a mental health diagnosis. So I think we can all maybe think of things that are what we might call pet peeves, or things that kind of get under our skin, things that irritate us. Those could be triggers. So again, just something that activates you or brings about some specific thought or an intense feeling. For example, the feeling of anger and frustration might be triggered whenever, if someone cuts me off in traffic. And that I don't necessarily have to have a mental illness or a diagnosis in order for that to be a trigger for me. So the causes of mental illness, of course, can be extremely multifaceted, meaning there's tons of a combination of factors that contribute. And so triggers can definitely be part of that, but may not necessarily be the sole cause.
Right. So because the root causes of mental illness are so multiple. We talk about biology, genetic background. So it's deeper, more substantial, I guess, causes. But trigger is something to activate this mental illness, right? Basically.
Absolutely. Sure. Yes. Can definitely contribute.
And as a well person, you may have, everybody experiences emotions, but what happens when a child with a mental illness has a trigger? For example, you mentioned, somebody cut them off or disrespect them maybe, or so what's happening then?
Sure. So, so when a child is triggered, I think that it's going to look different, of course, depending on the child and depending on what their situation might be. So, depending on what their diagnosis might be, if they do have a mental illness, or depending on their history, a lot of times triggers are things that might be very personal to us. So, if a child has experienced some kind of trauma in their past, or maybe has had a significant experience that has stayed with them. They might experience something in school or in everyday life that triggers those memories, and that might lead to pretty emotional responses, disruptive behaviors. Again, it can look different depending on the kiddo. But, I think the difference between a kiddo who might be relatively healthy, well-rounded. They might have the capacity to manage those emotions that come up a little bit better than a child who might have a mental health disorder or might have a diagnosis. A kiddo that's pretty well-rounded and healthy might be able to bounce back pretty quickly. They might say, ouch, like that didn't feel good, or that brings up a painful memory, but I'm okay, I'm safe, or I'm going to talk to somebody about it and move on. Whereas another child that might struggle with managing their emotions might really get stuck in those feelings and might really feel like um, they're in danger, or whatever has happened has triggered all of these emotions and they kind of get overwhelmed by those. And they might need a little bit more support to work their way through all of those feelings.
Yeah, I think that what you're bringing up is that the time of recovery, which for a child, and thinking in a classroom setting, for example, and you have a child who gets that emotion and he's able to bounce back, but then another child will not be able to finish the day basically because of what happened at 10 a.m. in the morning, right?
Right, absolutely. That's a great way to distinguish that. Yes, the bounce back time, their ability to bounce back, to get back on track, to work their way through all of that may look really different.
Hmm. Yeah. Now, can you list some very common triggers and how they may impact different kids?
Sure. So again, there is, I mean, my gosh, a wide range, a wide variety. Working with, especially with teenagers. I mean, I think just about anything for some kids could be a trigger, just depending on their history. However, I think some of the more common ones that we tend to see could include, being told no, not getting what you want, or not getting your way. Maybe being accused of something, like being told that they're lying or not being truthful about something. Um, certain images, like I said, it could be related to, commonly we see things that are related to personal trauma. So maybe certain images or certain words associated with that trauma. Maybe being asked to do something they either don't like to do or don't feel comfortable doing, or being told that they were a disappointment in some way. So a lot of kids might feel very triggered by hearing, that they messed up or made a mistake, or disappointed someone. That could really activate some strong feelings, or a very reactive response. So those are, again, they can range and vary greatly, but I think those are some really common ones, especially we see with our younger kids, and parents saying, they hate being told no, or every time they can't do what they want to do, they go off. So those are some really common ones that we see quite a bit.
So that actually brings on another question is how do you know when it's a trigger or not simply a power struggle or manipulation?
Sure, I think that is really tricky. That can be tough. And I think the key there is knowing that it's almost never helpful or effective to tell a child that you think that they are being manipulative, or, you're just acting that way because I said no, or, it might be true. That might be what's happening, but the child may not have a great response. It may continue to escalate them if they're being accused of these things. So even when you think that your child is trying to manipulate you, or you're getting into a power struggle, they're still trying to communicate some kind of need that's not being met. whether it's a significant hurt or major problem they're experiencing, or maybe they're just feeling the desire for a little more attention and affection. It's important to not too quickly dismiss the behavior as intentional manipulation or power struggle, but to just acknowledge what you're seeing. I hear you. You really don't want to do this right now, but here's what I need you to do. Or maybe giving some options. Either you can do A or B, and I'll let you decide. But those are the choices that you've got. So again, it can be tricky, and I think if it's becoming a repeated pattern and something that's really getting in the way of functioning every day successfully, that would be a good time to maybe talk to a provider or seek counseling or seek additional help. But again, acknowledging that, not to dismiss it too quickly or make those accusations, is a helpful start.
Yeah, it makes me think of trigger calls trigger, right? In terms of like the trigger, if we trigger the child or the teacher or parent trigger the child, then the response of the child might trigger another response from us that it may not be that helpful either. So that's also something to be self-aware, right?
Yes, absolutely. So keep in mind as the adults, how you respond, your reaction if a student or your child says, I feel triggered, or I don't want to do this, I'm triggered, or this triggers me. Keep in mind the way that you respond, exactly as you said. It might lead to another trigger or continue to escalate the situation. So I think, again, just because we might validate how our child is feeling or what they're expressing doesn't mean that we necessarily agree or even understand what they're expressing, but it helps them to know that we're hearing them and we are paying attention. And sometimes that's all they need to kind of get back in control and be able to regulate themselves, is just knowing, okay, they hear me, they see me, I can maybe take a breath and calm back down and move through this trigger.
Yeah, or we may have to distance ourselves, or parents may have to distance themselves, like, okay, we need a break here because it's too intensive, right? Or it's too much emotion.
Sure, yeah, maybe it's time to take a break or take a time out to kind of recompose.
Yeah. Now, what do you do? Well, first of all, how do you create a safe environment for children with a mental illness, given that understanding of triggers?
Right. Yeah, so I think there's some really basic things that, of course, every child is going to benefit from, but absolutely a child with a mental illness. I think providing an environment of unconditional love and support as parents, communicating to your children that you love them, that you support them, providing lots of positive feedback and encouragement. In the classroom setting, that might be where that's going to be really important for teachers to know, giving positive feedback when they can, encouraging their kids, especially kiddos that might struggle with a mental illness. I think still maintaining appropriate boundaries and discipline is super important. Even a kiddo with a mental illness that might have some significant challenges, that's not necessarily a free pass to let go of all boundaries and rules and consequences. Those things are still really important. Kiddos need that framework that provides a lot of safety and support to help them be successful. Of course, good nutrition, medical care, meeting those basic needs are super important, especially for a kiddo with a mental illness, because as we know, even things like diet or addressing any kind of medical conditions can be closely related to mental health and can affect mental health. And then I think really having open, honest, transparent communication as much as possible, making sure that the child knows that it's safe to talk about these things. It's safe to talk about hard things, and that they are going to get the support and the understanding that they might need, but they're not going to be judged or criticized or punished for being honest about how they feel and what they're struggling with.
Now, what do you do when there's a child is triggered and goes into a crisis?
Yeah, that can be really tough. Depending on the child, that can maybe feel very intense and extreme at times. I think one of the biggest things is as the adult, doing your best to stay calm and grounded and able to keep your own emotions regulated. Because I think what happens is as the child is escalating, they need some help being able to regulate. You know, they are dysregulated in that moment of crisis, and they need some help being able to come back down and get back in control of things. And if the adults in the environment around them is also kind of chaotic and escalated, it's going to be really hard for them to be able to do that. So I think as the adults, taking a deep breath, reminding yourself, like kind of coaching yourself of um, what you need to do to stay calm, whether, if your kiddo is really saying some ugly or maybe hurtful things, reminding yourself that they're upset, they don't mean it, don't take it personally, stay calm, just providing that safe space so that they can kind of come back down. And I think another thing that can be really helpful is just saying what you see. You don't necessarily have to fix it. You don't necessarily have to give them instructions because if they are in crisis and escalated, they probably are not going to have the mental capacity to understand and process what you're saying. So just saying, I see you are really upset. I see, wow, you are really angry. Or I see a lot of emotion. You're crying. You are really upset about this. Let's take some deep breaths and just keeping things really simple, really concise, and very clear. Because again, if you're asking too many questions like, what happened? What's wrong? What's going on? Explain to me what's happening. That might really continue to overwhelm them and escalate them and be really hard for them to process. And so I think just making your goal to help them calm down and de-escalate. And then there'll be a time to be able to process and debrief and talk about what happened once the child is calm, once that prefrontal cortex is back online and that ability to think clearly is back online. So I think that that's going to be the key is just, take some deep breaths. Maybe, is there a stress ball or some kind of comforting tool or toy or something that helps that child to calm down and just really focusing on getting them back to a calmer space.
And that can take some experience because I know when the parent first encounter this kind of crisis is very disconcerting and it could be very difficult. And so that's maybe an area too, if a parent is not feeling like they can manage that very well, that they need help too, right?
Mm-hmm, mm-hmm.
To learn how to do this.
Sure, absolutely. I know that that can take some practice as the parent. And, I think it is okay for a parent to say, I need it, or let's take a break. I see you're upset. I'm feeling upset too. Let's take a break. Whether it's let's go to our rooms and cool off, or let's go to like a safe space in the house to cool off. And then we're going to check back in 10 minutes or whatever time frame feels appropriate. Making sure that you do check back in and not just kind of let it go and forget about it and move on, but doing whatever you need to do as the adult to take that break and calm yourself back down too. That is very important. And it does take practice. And I think there are some situations where maybe that's not realistic. Maybe you're trying to get out the door and you're trying to get somewhere and you just need them to get it together and jump on board with you. And so that might be tough in some situations, but I think when you can practice those skills, whether it's okay, let's take a deep breath, um, stay in control here, I think then it gets easier over time.
And if you feel danger, what do you do? Like
I'm
if
sorry.
it's at a point if you feel like, okay, this is getting so out of control, I can't even control it.
Sure, that can be scary. If you feel like it is getting out of control and as the parent or the adult, you are not able to control it, I think again, it just depends on the specifics of the situation. I think in extremely urgent or crisis situations, of course, if your option is to call 911, then make that call absolutely because you wouldn't want to risk putting yourself in danger or putting your child in greater danger. If you're trying to manage the situation and it's escalating to a dangerous place, you might mean well, but it could still get out of hand, or something might happen that you wouldn't want to happen. So I think it's okay to call 911, let them know you have a mental health crisis if that's the situation, and they can respond appropriately and provide some assistance there.
And they have special trained teams, right, that help families and make sure to mention that it's a mental health crisis because they have expertise teams for that.
Absolutely, yes. I know with the San Antonio Police Department, they do have special, I believe it's crisis intervention teams,
Right.
or a specifically trained department that are for mental health issues. So yes, clarifying this is a mental health crisis. It's a child, if that needs to be expressed, so that they know how to respond appropriately.
Absolutely. We have a question in the chat, and by the way, I want to remind our audience they can ask questions in the chat at any time. What are other techniques to help a child regulate? And I think it kind of ties well with my next question, which was about building resiliency, teaching resiliency.
Sure, absolutely. So in the moment, I think there are maybe two different things or approaches to that. If you're in the moment of crisis and you're trying to help a child regulate and calm back down, again, I think focusing, keeping it very short and brief instructions, let's take some deep breaths. Let's count to 4 and model that yourself, start doing it with the child, breathing in for 4 counts, hold it for 4 counts, breathe out for 4 counts, and just repeat. And if the child isn't responding at first, give it a little bit, give it 30 seconds, give it a minute to see, because it might take them a minute to register what you're doing and to be able to mirror and follow along with what you're doing. If the child enjoys sensory things, if they like playing with something or fidgeting with something, if you have a stress ball or something that they can squeeze, I have all kinds of fidgets sitting around here that we play with during sessions, that they can kind of squeeze and really focus that emotion into that stress ball or that item, whatever it is. Maybe it's a stuffed animal at home that they could manipulate. There are some other really simple tools, like if you notice a kiddo is starting to escalate and you want to try to distract them from whatever it is that's upsetting them, maybe asking them to name every animal that they can think of. Let's name every animal we can think of, or let's name all the foods that you can think of, or tell me the names of all the people in your family. Just anything random that is they're going to be able to spend a lot of time having to think about and name, so that they're distracted from whatever initial thoughts were upsetting them, and they can have some time to de-escalate and calm back down. So those are just some really basic tools and skills, and of course there are tons of them out there. But when you're out of the crisis, and I think when it comes to building resiliency in kids, I think reminding them that even when they feel triggered, even when something upsets them, remembering that they are physically, if they are, hopefully, but they're physically safe. If someone calls you a name, or if, the teacher asks you to answer a question in class and you feel triggered by that, remind yourself, like, I'm okay, I'm safe, I'm in a safe place, nothing is physically harming me. Because what happens is our brain triggers that fight, flight, or freeze mode, and it can't differentiate if I'm really physically in danger or if I'm just mentally kind of in danger.
Right.
So reminding yourself, I'm physically okay, I'm safe, I can get through this. And having those conversations with your kids outside of those crisis moments about you in that moment, or what is it that you're feeling, and can we talk about that, and can you explain that to me, help me understand that. And that might give you some ideas of how to help them reframe and see that situation differently, so that they can be a little more resilient in the future.
Yeah, I think you mentioned a very important point, that idea of the brain reaction, and that control that triggers our anxiety, for example, and other emotions, but especially anxiety, and kind of bringing back that to a space of safety is a practice, right? And whether are there activities that you can practice almost every day to to manage that better over time?
Sure. I think that, things like making some space for some quiet time. I know that's really tough these days with our kids because we're go, go, go and on screens and technology. But I think that that's part of why it's so hard sometimes for us to manage and regulate all of those feelings because they're coming at us so quickly. And so I think the more we can help kids have some quiet time, whether it is quiet time to practice some deep breathing, or maybe we read a book together, or, for older kids can definitely benefit from like meditation practices or listening to like a guided relaxation video. If you go onto YouTube and you just search guided relaxation exercises, you will get thousands upon thousands of different narrated clips that can be really helpful in walking them through like muscle relaxation exercises, things that can be very calming and soothing, which I think eventually allows kids to develop the ability to pay more attention to what they're telling themselves and how it impacts their reaction to certain events.
That's really good. Yeah, the idea of what am I telling, what is the internal dialogue that causes these triggers to amplify versus to calm them down, and maybe talking to somebody. Well, and that brings me to my last question, almost last question, is when would you recommend therapy, and what specific therapeutic interventions can help?
Sure. So I think, like I said earlier, when it starts to become a consistent pattern and it's really disruptive to the child's life, so maybe they're really struggling to manage throughout the school day, maybe they are really explosive and consistently explosive and difficult to manage at home, and they're not able, like we don't see any improvements and things are really worsening. I think that's when it's time to seek some additional support and maybe look into counseling and therapy, and some other resources. And as far as the type, I think again there's all different styles of interventions and things out there. I think what's most important is finding the right fit for the child. So someone that the child feels comfortable with, feels safe talking to, because I think what we have seen and what we know from research is that that therapeutic relationship between the child and the therapist is what is most indicative of the ability to change and make progress. And so if the child feels safe and comfortable, most likely whatever intervention that therapist is going to recommend hopefully will lead to some results, because the child feels safe and trusts the therapist and can make improvements there. There are some very common evidence-based practices such as cognitive behavioral therapy that can really help with changing the way we think, and so therefore how we interpret situations and decreasing triggers. But again, I think that right fit is what's most important.
Sure. Now, I have another question in the chat. Sometimes we have students who, as teachers, we don't seem to be able to point out what their triggers are. And so what do you suggest for this?
Sure, that's a great question. I think, I wonder if there's a way, because I know we want to keep teachers in the teacher role. They already have so much on their plates, and we don't want teachers to or expect them to be therapists, because that might be a lot. But at the same time, I wonder if there are ways to, if you're noticing a child that is reacting in certain situations or tends to be more sensitive or more emotional or more reactive in classes, maybe having a conversation with that child, or maybe if that doesn't feel safe, checking in with parents or the school counselor to see if there's already some identified information or triggers for that child. But I wonder if, like, for older kids, it's possible, at the beginning of the school year or as you're getting to know kids through like the icebreaker games or get to know yous, maybe asking, is there anything I should know that I should be sensitive about, or that, might, or that we should, trying to think of how to word it, but anything that
makes you very uncomfortable. I mean, that's just simply like, is there something a situation that makes you very uncomfortable?
Absolutely. Yeah. And if you hit a trigger as a teacher during class, you do something that seems to upset a kid, I don't think that all hope is lost. I think
Right.
being intentional about how you respond and maybe taking time outside of class or individually to check in with that student and just try to understand what happened from their perspective and if you can kind of collaborate to move forward.
Actually, that's a great point. That's like sometimes a trigger can actually be therapeutic if you manage it well, and it becomes, just like if you have a issue with somebody you love, and you actually process it, and it brings you closer eventually, right? So
Absolutely.
it's not always very negative. Oops.
Yes, absolutely. It can be definitely an opportunity for growth.
Hmm. Very interesting. It's a fascinating topic. Well, what would be your last recommendation? I mean, school, has been virtual for many families. Possibly it's gonna be in person in the fall or in the summer. This for the first time. Sometimes some kids will go to school for the first time, maybe, right?
Yes.
Any recommendation?
Sure. So it is definitely, I mean, obviously it's been a challenging past year, especially for our kiddos and the school situation, and has been kind of all over the place for a lot of our kids. And returning back to school in the fall, for a lot of kids going back in person for the first time is sure to be overwhelming and probably come with a lot of challenges. So I think being patient with our kids, making sure our expectations are realistic, knowing that yes, we might all be excited and thrilled for kids to be back in school in person and have a more normal routine, but it may take some time. Things were very different for a long while, and so being patient and kind of again having those realistic expectations of our kids and providing some extra support, acknowledging, hey, yeah, it might be overwhelming to be in a school full of kids and people again after not having done that. For parents, maybe it's a good idea to practice with your kids going to some safe spaces or, taking them to the grocery store if they haven't been around large groups of people, of course, doing that safely. But just trying to find ways to safely, slowly reacclimate them to those environments if you know they're going to have to return in the fall.
Absolutely. Lots of potential triggers. It's a good thing. I think that kids will be able to get back to school, but we've got to
Sure.
prepare for it.
Absolutely.
But thank you so much, Andrea. That was really informative, very helpful. I think we're really excited to have parents here and to be able to share this information. I want to make a few announcements before we close. I'm sharing in the chat box the events calendar because we have some really exciting events coming up. So next parents chat will be on April 7th, and it's about fighting social isolation in teens. The big issue right now with COVID. The next one is actually after that, the next day, on April 8th at 7:30 p.m. that time, we will have a special interview, also a webcast, with an author, internationally known author called Trevor Romain, who has spoken to children all over the world in the past 30 years. He's helped kids who had cancer. He's helped military families, military kids. He knows a lot about connecting with children. And so we're going to have a very exciting interview with him on connecting with your kids during a rough time. So if you want to sign up, we require a registration for it. Go on our calendar and check that out. On April 28th, we'll have a Stronger and Happy Heart event, which is a participating event when parents can actually connect with one another and have very robust conversations about children's mental health. Last but not least, if you're a professional, check out our Clarity Con event on April 9th. So with that, thank you very much, and we will see you in a couple of weeks. Thanks, Andrea.
Thank you.